So let's now start our first session, and our first speaker with an update on the research portfolio at the Canadian Institutes of Health Research. It's my pleasure to introduce Dr. Nina Cluny, the Assistant Director of the Institute for Neurosciences, Mental Health and Addiction at the Canadian Institutes of Health Research. Thank you so much for joining us today.
Thank you very much for inviting us, and thank you for the introduction. I will just share my screen. Can I just check that you can see my presentation view, slide 1? Thank you very much. So as Dr. McKillop said, I'm Nina Cluny. I'm the Assistant Director at the Institute of Neurosciences, Mental Health and Addiction at the Canadian Institutes of Health Research. And I'm very happy to be here today to present an update on what CIHR is doing and our integrated cannabis research strategy. Before I do start, I'd like to acknowledge that I'm joining you today from the traditional territories of the people of the Treaty 7 region in southern Alberta, which includes the Blackfoot Confederacy, comprising the Siksika, Piikani and Kainai First Nations, as well as the Tsuut'ina First Nation and the Stoney Nakoda, including the Chiniki, Bearspaw and Wesley First Nations. The city of Calgary is also home to Métis Nation of Alberta Region 3. So on October 17, 2018, the Cannabis Act came into force in Canada, legalising non-medical cannabis products, including fresh and dried cannabis and cannabis oils. Other products, such as edible products and concentrates, became legally available in the fall of 2019. And there was then, and still are, many unknowns about the use of cannabis, the health and safety effects, and the behavioural, social, cultural, ethical and economic implications of legalisation, both nationally and across jurisdictions. Stakeholders called for support for new research initiatives and evidence-based approaches to federal activities. So prior to legalisation, CIHR, in collaboration with Health Canada, led the development of the innovative and collaborative Integrated Cannabis Research Strategy, or ICRS, to support the advancement and translation of scientific knowledge on cannabis in Canada. CIHR have forged a number of partnerships for the strategy. We partner with the Canadian Centre on Substance Use and Addiction and the Mental Health Commission of Canada on multiple funding opportunities and knowledge mobilisation activities. We've also partnered with some health charities, and it won't be a surprise that those with which we've formed partnerships are those which are related to areas where there has been shown to be a therapeutic benefit of cannabis. So the Arthritis Society of Canada, Canadian Cancer Society and the Multiple Sclerosis Society of Canada. We've also partnered on a number of activities with Veterans Affairs Canada. And more recently, in partnership with MHCC, we've formed partnerships with the Canadian Consortium for Early Intervention in Psychosis and the Schizophrenia Society of Canada Foundation. Also involved in the strategy in partnership are 6 of the 13 CIHR institutes, and all of these partnerships represent an investment of over $36 million for cannabis research in Canada over 9 years. The objectives of the ICRS are to provide evidence to meet stakeholder needs, to help inform evidence-based policy and practice decision-making, to ensure data and information sharing through open science practices, and to facilitate pan-Canadian collaborations. The overarching vision of the ICRS is that a well-coordinated series of activities can position Canada to be a world leader in developing the research capacity and amassing the research evidence that's needed to appropriately roll out policy and regulatory models for non-medical cannabis use. The ICRS supports parallel streams of research, understanding harms and the medical benefit. And underlying these streams are research activities which serve to synthesize, standardize and increase access to evidence. And this has particular relevance for federal, provincial and territorial policymakers, service providers and other knowledge users. The research activities also serve to fill evidence gaps in specific target areas. And the activities here will allow for multi-year research efforts and also provide flexibility for rapid response initiatives to provide timely evidence for emerging priority areas. The ICRS was designed in such a way that each funding opportunity builds upon the last and ensures that the research that we're funding is where the need actually lies. And this iterative bidirectional process focuses around the cycle of identifying knowledge gaps, developing and launching strategic funding opportunities, and the facilitations of knowledge mobilization. So because the ICRS is not only about supporting research projects, but also ensuring that the mobilization of the knowledge generated through that research, we have a knowledge mobilization strategy embedded within the ICRS. So at the funding opportunity level, we strive to have a knowledge user integrated within a research team, and that type of knowledge user would obviously be dependent on the type of funding opportunity and the project. So it could be a service provider, a person with lived and living experience, a policymaker. We also embed the requirement for knowledge mobilization reports to be submitted to CIHR from the researchers, and they're either on an annual, midterm, or an end of grant basis, depending on the funding opportunity. These reports are really important for us because they include a plain language summary of findings and the study implications, as well as that research project's knowledge mobilization plan. So they can help us inform the planning of our knowledge exchange workshops and also help us to amplify anything that researchers are doing and develop other potential knowledge mobilization activities. So that second part of this slide is the knowledge exchange workshops that we hold. They include not only researchers kind of talking about their findings among each others, but also we invite the knowledge users from each of the projects to attend, people with lived and living experience and other stakeholders. And the objective of these workshops are to share research findings and also bring real-world context to those findings. Following those knowledge mobilization events, we produce reports that are shared publicly to help further disseminate the evidence and knowledge. And so far, we've launched 3 short-term funding opportunities. These are typically one-year funding opportunities, and they've laid the foundation for 3 multi-year funding opportunities to be launched. So in 2018, through the Population Health Intervention Research on the Legalization and Regulation of Cannabis in Canada grants, CIHR funded 14 projects to generate data and evidence to monitor and evaluate the potential benefits, harms, and unintended consequences of legalization. And these projects aim to build the evidence base. Remember, these were right around the time of legalization. So to build the evidence base to support cannabis-related policy and program development. And we supported research that included projects on data infrastructure, impaired driving, pregnancy, childhood and youth health, as well as the impacts of policy changes on different populations, including Indigenous populations. Then in 2019, CIHR, the Canadian Centre on Substance Use and Addiction, and the Mental Health Commission of Canada funded 26 projects through the Cannabis Research in Urgent Priority Areas Catalyst grants. And these one-year grants supported research to investigate the potential benefits and harms of cannabis, focusing on urgent priority areas that had been previously identified through stakeholder meetings and a knowledge gaps workshop. Those supported projects pertained to research areas such as the investigation of the effects of cannabis use on mental health, neurodevelopment and pain management, as well as research on prevention, harm reduction and treatment of problematic use of cannabis. So the federal government enacted the Cannabis Act, but it's actually the provinces and territories that are responsible for developing local cannabis policies in their jurisdictions. And so the Partnerships for Cannabis Policy Evaluation, or PCPE, funding opportunity was developed by CCSA and CIHR to support projects that would produce research evidence to inform current and future cannabis policy at the provincial or territorial level. Was developed to support research, to evaluate and monitor both the implementation and impact of cannabis-related policies, so that best practices can be identified from both a public health and public safety perspective. The researchers have begun to develop multi-team cross-jurisdictional collaborations. We hope that this will maximise data collection and knowledge exchange, and hopefully result in the ability for comparisons across provinces to be made. We have funded projects evaluating policies that are related to driving and traffic safety, workplace cannabis use, retail stores and cannabis product labelling, as well as quite a heavy influence on the impact of policies on youth. In early 2020, the Team Grants Cannabis Research in Priority Areas initiative funded 14 5-year projects to explore in more detail the potential therapeutic benefits and harms associated with cannabis use in a number of targeted areas. Research is underway in this, and I see the huge similarity between this slide and the slide that Dr. McKillop just showed. And hopefully that kind of solidifies the fact that these knowledge areas are being understood on a national level, and that research is ongoing in these areas. So we have research underway with projects investigating medical benefits of cannabis, for example, cannabis as an osteoarthritis therapy, for symptom management for children in cannabis, as well as the use of cannabis for acute and chronic pain. And then we also have projects that seek to better understand the harms of cannabis use. So, for example, the effects of cannabis on lung health, on Indigenous peoples' oral health. And there's a large focus among these projects on the mental health impacts of cannabis use. The most recent funding opportunity to launch under the Integrated Cannabis Research Strategy is the Cannabis Research in Longitudinal Studies competition. And this funding opportunity, the funding will start for these 5-year grants this summer. And there are 2 components to the funding opportunity. So CIHR Institute of Neurosciences, Mental Health and Addiction, and the CIHR Institute of Human Development, Child Youth Health will be providing support to leverage existing longitudinal studies to add the collection and data analysis of samples relating to cannabis use. So trying to establish patterns of cannabis use, identify the impacts of cannabis use, and to inform future interventions. The second component of this funding opportunity is to support a new longitudinal study on cannabis use in veterans. And so since 2007, Veterans Affairs Canada has reimbursed veterans for cannabis for medical purposes. There's actually limited information on the patterns of use of cannabis among veterans, or the physical health or mental health impacts of using cannabis in this population. And so in partnership with the Veterans Affairs Canada, this part of the funding opportunity will provide support to examine the benefits and harms of medically authorised cannabis use in Canadian Armed Forces veterans. So this slide shows the timelines for the ICRS in its entirety. The funding opportunities are listed and shows the research or the funding period, as well as the knowledge mobilization or KM activities that have been associated with each. We do intend to have knowledge mobilization activities ongoing for the projects that are currently in their research stage. I think this nicely highlights that we have projects funded through the ICRS that span the breadth of cannabis research, from biomedical research on biological systems right through to public health issues such as impacts on policy changes. Our goal is that with timely knowledge mobilization of the evidence from this research, we can get the most up-to-date and relevant information into the hands of key stakeholders across Canada to help inform policy, practice, and public education. And in closing, I just want to highlight where you can find the reports and summaries from our knowledge exchange events. So the Integrated Cannabis Research Strategy web pages can be found on the CIHR website by navigating through the Initiatives tab. And then you can find out all about the ICRS. Under the Publications tab on the left here are the knowledge mobilization products. And our most recent addition was just added in the last few weeks. Is a What We Heard report from the annual workshop for the Partnerships for Cannabis Policy Evaluation Grants. So thank you very much for your attention, and I'd now be happy to take any questions.
Thank you very much, Dr. Cluny. If you have any questions, you can please type them into the Q&A box, and then I can read them out. And if there's no immediate questions, then, but you think of something as you go, you can still type it in, and Dr. Cluny can stay on and open up the question box and answer them as we go through.
All right, well, we will continue to get those in. Thank you, Dr. Cluny, for a wonderful presentation. It is really excellent to hear about all the ways in which CIHR is supporting cannabis research to really make sure that we understand the implications of some of the policy changes that where there might be therapeutic benefits, and importantly, where there might be harms that are currently under-recognized. So thank you for an excellent presentation.